Hello everyone, welcome back to my channel Budding Homeopath. In today's lecture, I will be discussing about anatomy and human skeleton. For for lots of people, this term anatomy and the human skeleton is very much difficult to understand. But I can assure you, if you don't skip my video, you will be understand everything very easily. Okay, so let's start. I myself, homeopathy medical student. Okay. So, human skeleton, it means we are dealing with the bones. So, how many bones are there in adult? 206 bones. And these bones are divided into two categories. One is axial skeleton and other one is appendicular skeleton. Now, what is axial skeleton? See, if there is a skeleton, right? So, this is the, once again, this is the midline. Okay, this is the midline. We will come to this terms of midline, lateral. Okay, so this is the body and this is the midline. So around the midline or in the midline, the which bones are present, it's called the axial. Okay, axial bones. And appendicular means away from midline. For example, the limbs. Okay, so the upper limbs, or you can call it as a superior extremity, and the lower limbs, which you can call inferior extremity. Okay, now when we are dealing with the axial skeleton, we have skull. Okay, skull means we have to understand, or we have to read about cranium bones and facial bones. Okay, you can say the cranium bones are the bones of the head region. Okay, and also the facial bones, and then the hyoid bone, then ear ossicles and thoracic cage. Now when we are dealing with the thoracic cage, you have to know that we have the sternum there, which is in number in 1, and also we have the ribs, which is 12 pair. Okay, but with the numbers we will come to later. Okay, and then we have the vertebra, which is present posteriorly. Now you guys will ask me, what is posterior? Posterior means back of the body. We will come to this type of terms. Okay, but for now, this is the structure of our bones. 206 bones divided into two parts, axial skeleton and appendicular skeleton. For axial skeleton, we have 80 bones. For appendicular skeleton, we have 126 bones. Okay. 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 First, we have to be very sure about how we should be standing. Okay. How we should be standing, how we should be study the anatomy, means studying the movements of the body, studying the bones, how we can study. Okay, so there is one position which is known as normal anatomical position or standard anatomical position. So this anatomical position is very important for your viva, and also this is very basic, but it's very important. So what is it? The anatomical position, the person, okay, or the cadaver means the dead body. The medical students, there is a topic called dissection. Okay, it means cutting the dead body and then studying the organs, the bones, the everything. So the cadaver, okay, and the picture. Okay, we will come to it. So you have to stand in the anatomical position, or if you look a picture, or if you look anything to understand the anatomical movements, that must be in anatomical position. Now if I show you this pic, this is whether this is anatomical position or not. you can understand, but this is the very good pic. Okay, see, the anatomical position means the person will be straight. Okay, will be straight, or you can say the person is erect. Okay, looking forward. Where he is looking forward, means we can see that this person is looking towards us. Okay, so he is looking forward. Upper limb at their sides hanging. This is very important. See, this hand is not touching. Okay, this hand is not touching. This hand is not touching the body. It's just hanging in the air, we can say. Okay, wait, let me remove this arrow. One second. Okay. So the hands are not touching the body. This is very important point. Palms are facing forward. This is very much important. Okay. If you still touch your body, it's okay. But the palms should be always facing forward. This is very important. Even in my anatomy, even in my college, my professor also asked me to stand in anatomical position, and I was standing in. Okay, so this is very important. The palm should be faced forward, because if palms are not facing forward, the whole anatomical position will be wrong, the study of the bones will be wrong, the naming of the bones will be wrong, everything will be wrong. Okay, so it's very important that the palms are facing forward. Feet are together. You can keep it together or slightly upward. That will be not a big issue. Okay. Now, in anatomy, sometimes there is confusion. Okay, that this side is right side or this side is left side. So for that, make it very clear that the right and left, it is decided with respect to patient, cadaver and picture. Okay, so if I tell you that which side is this, okay, so, and which side is this, so this is left side, okay, and this is right side. If I tell you which side is this is right side and this is left side. So what is which, like, this right and left is not decided with respect to doctor or the medical student. It is being decided with respect to patient, cadaver or picture. So here we have the picture only, and for this picture we can say that okay, this is left side and this is right side. As I am doing this video, this left side is my right side. Okay, so don't get confused. This is very much important. Always and always it is being decided on patient or cadaver, means dead body, or picture. Okay. Okay, let's go to next slide. Okay, now we are coming to the body and the regions. Okay, so which regions? Here is one funny thing. Okay, we'll come to it. Wait, first let me remove the okay. So head region. See, we have pointed here 1. So head region, this is head region, and then there is the neck region. Okay, and then here we can see this is our thorax. Can you name the 2 important organs in our thorax? You can pause the video and comment me. So there are 2 main organs which are known as lungs and heart. Okay. So then we have the thoracic cavity, or you can say the thorax also, thorax region. And then there is one diaphragm, which is the part which is separating, okay, which is separating the abdomen and the thoracic cavity. Okay. So number 3 is thorax. Number 4 is abdomen. And then we will come to inferior extremity first, and then we will come to superior extremity. So there is one hip joint and knee joint. Okay. So hip joint and knee joint, between the space, we will call it as thigh. See, number 5, hip joint to knee joint, this place is known as thigh region. And then this is knee joint and this is ankle joint. This place is known as leg. And rest from ankle joint is known as foot. Okay. And now let's come to superior extremity. So this is shoulder joint. We know very well. Okay. But so shoulder joint term is very easy. There are so many terms. Okay. But you can, for now, you can say just, okay, this is shoulder joint. So this shoulder joint to elbow joint, this place is known as arm, or you can say upper arm or brachium. Now, why the term brachium is present? There are so many muscles. For example, coracobrachialis, biceps brachii, and so on. So, for this reason, the term brachium. And also, when we will study about the aorta, the artery supply, the arch of aorta, there also the brachiocephalic is going on. So, by that, we will discuss it later. But for now, just remember the shoulder joint. Once again, the shoulder joint to elbow joint, this place is known as arm or brachium. See, in your Viva questions, if you say arm, it will be okay only. But if you say brachium, the marks of your exam will be increased. See, so for this reason, it will be good if you say brachium. Okay, now let's go to the next part. So, as we have discussed, this is the elbow joint and this is the wrist joint. Okay, wrist joint. So, this, the B part, this region is known as, from elbow joint to wrist joint, this region is known as forearm. You can say it's forearm or antebrachium. Okay, again, this antebrachium term is very important. Sorry. And the rest from wrist joint is known as hand. Okay. Now, let me ask you one question. If I ask you, if a patient come to you, or let's say you go to a hospital or a doctor, complaining about, I have pain in my left leg. Can you explain me where I'm saying it, where you are saying it, where you have the pain? Do you have the pain on the fifth region? No. As the complaint is concerned about, I have pain in my left leg, it means left leg means this like inferior extremity, and the leg part means the knee joint to elbow joint. Sorry, knee joint to ankle joint. Number 6. See, knee joint to ankle joint is leg. Okay. So this is how you can understand. The whole part is not leg. This is thigh, this is leg, and this is foot. Similarly, this is brachium, this is antebrachium, and this is hand. Okay. I hope this is clear to you all. Now, if we discuss about the posterior region, so you can say this is back region, and this is very much funniest. This is the gluteal region. You can say that the 8th number, gluteal region. So from next day, if you want to, in your friend zone, if you want to say something rubbish to your friend, or which is including with this gluteal region, just say gluteal region. Okay, so this is the, this is the plus point of being a medico. Okay, let's go to next slide. Terms in gross anatomy. Guys, I haven't put all the terms here, only for which are the needed for to study the bones. I have placed it here, but this is very important. See, I can directly go into the, the bone section, but before that, I have to discuss all this, the anatomical position, the terms. Otherwise, you guys won't understand anything. Okay. Okay. So, firstly, we will discuss about anterior or ventral. What does it mean? So, anteriorly or ventrally, it means the frontal side of the body. Okay. So, if we come to this picture, see, anteriorly it has eyes, nose, lips. Similarly, in our body also, we have anteriorly eyes, nose, lips. So, this is the anterior side of our body, the frontal side of our body. And the posteriorly where we have the spinal cord. Okay, means this picture, the picture number 2. So this is the posterior side. Okay, or you can say it's a dorsal. Okay, superior. What is superior? Superior means towards the top of the body, and inferior means towards the bottom of the body. See, I was telling not upper lip, I was telling superior extremity. Both are same. Okay, superior means towards the top. Okay, now if I give you two point. Okay, so let me give one point is here. Okay, let's make it on other color. Okay, so this is 1 point. So this is 1 point, and let's say this is 1 point. Okay, this both this white this two are okay. Now let me now please tell me that in this 2 point, which is superior and which is inferior. Obviously, you will say that this point, which is present in the thoracic and abdomen in between this part. So you can say that this is the superior point, and which is present in the thigh region. This is the inferior. Okay. So I hope you have already understood what is the term says here. Okay, so superiorly and inferiorly. Now we have to understand what is medial and lateral. But for that, first we have to draw a midline. See, everything is doing on this particular anatomical position. This is very important position. So first let me draw a midline. Please excuse me for the bad drawing. Okay. Okay. So this is a midline. Okay. So this line is, it's just in the middle of the body or the picture or the cadaver. So this is the midline. If something is coming towards the midline, okay, or let's say just beside the midline, we will call it as medial. And if something is away from midline, then we will call it as lateral. Okay. So again, if I give you 2 point, this is say this A is 1 point and this B is other point. So you can see the A is beside, around, or let's say towards the midline. Okay, this is more closer. The A point is more closer to the midline, and B point is far away from the midline. So we can say the point A is so we can say the point A is medial and point B is lateral. Now, lots of students, even myself, when I was just starting my journey, I was also confused with median and medial. So there is one term named as median. It means it's present on midline only. And there is one more term, medial. It means towards the midline, not exactly in midline. It's towards the midline. And lateral means away from the midline. Okay. So I hope you have understood this terminologies. Okay. Now let's go into the okay, proximal and okay. So medial, you can see closer to the midline, lateral away from the midline. Proximal. So proximal and distal. Proximal, which we can say, okay, I am giving you 2 point. Let's say the B point and the C. There is 2 point. Just imagine there is 2 point, B and C. Which is near to the heart? You can definitely say, okay, this B is near to the heart, is closer to the heart. Okay, it just go to this like and then joins the heart. But for C, it has to cross the same path as B, but extra towards B. Okay. So the from B and C point, the C is it's away from the heart, but B is closer to the heart. It means the B will be proximal here and D will be distal here. This is very important point. All these points are very important actually, but this proximal and distal you have to understood it. Okay. See, closer to the heart and distal is away from heart. Why I am telling you all these terms, you will understand now. Okay. So, as we have discussed that we have 206 bones, axial skeletal and appendicular skeleton. Axial skeleton, we have the skull bones, and in skull bones we have the bones of the, you can say, the skull region and also the head region and also the face region. Okay. So here comes cranium bones, or this is known as calvaria bones. Okay, this is 8 in number. So cranial bones, there is one frontal bone. Okay, frontal bone, 2 temporal bones. Okay, temporal bone, here you can see this is marked. Then parietal bone. So parietal bone is here. This is 2 in number. So as this is a lateral view, it's difficult to understand, but if you see some other pics, you can see this. Okay, all the bones which are in 2 in number, you can say one is right and one is for left. Okay. So this is parietal bone, and there is the behind, there is one occipital bone. Okay, this is 1 in number. Sphenoid, you can see this violet color is sphenoid, and ethmoid bone. You can see it here. Okay. So frontal, temporal, parietal, occipital, sphenoid and ethmoid. So temporal and parietal are 2 in number. See, it is just present here where the ear is present. Okay. So temporal and the parietal, and rest all the bones are in 1 number. Okay. As you can count, 2 plus 2, 4, 5, 6, 7, 8. Okay. 8 bones. Now we are coming into facial bones. Okay. Facial bones, we have 14 in number. So first we can see that we have 2 nasal bones. Again, for one for right and one for left. So okay, so these are the nasal bones. The zygomatic, or let's call it as cheekbone, because these bones, see, this is just in the cheek. Okay, you can also touch your own face so that you can understand it better. And the maxilla or the upper jaw, this is also in 2 in number, because one is for right and another one is for left. Okay, so this side is left and this side is right. I hope now it's clear to you all. There's only one bone in our lower jaw, which is also known as the mandible. This violet color is mandible. So there is 2 bone named as palatine. You can see it here, the palatine. One is for right and one is for left. Lacrimal, you all know the term with lacrimal. So these are the lacrimal bones, and also the inferior nasal concha. So this is the inferior nasal concha and vomer. Okay, so this is the vomer bone. Okay, I hope it's clear. You can also count whether it is 14 or not. Okay, now let's come to the next thing, which is vertebral column. This is very important and very much needed to learn. So vertebral column, 26 bones for adults. Okay, so how many bones for adults? 26 bones. So first we can see the cervical. The cervical, we have 7 vertebra. As you can see, the green part, cervical 7, C7 is present. And then the thoracic, 12 vertebra. Okay, T12, C7, we call it as this, C7, T12. And then the lumbar region, see the 5 lumbar region. Then the sacral region, this is 1. And then the coccygeal region, this is also 1. So now you can call it as coccygeal, okay. But the sacral region, which is 5 fused in 1. So for the babies, it is actually 5. And for coccygeal region, it is for the baby. Sometimes it is 3 or sometimes it is 4. Okay. So now if you calculate the numbers, you can easily see for adults it is 26 only. Like this 5 is fused in 1, this 4 are fused in 1. Okay. So for adult, the vertebral column is 20 for 26. For newborns, it is 33. But if it is 3, then it will be 32. Okay. But general number you can say is 33. And this is very important picture. You can remember it like this. C7, T12, L5, S1, C1. Okay. Okay. Now comes the favorite person, the favorite picture of me and lots of person, which is thorax. Okay. Why is it favorite? Because here we know the heart is present. Okay. Okay. Let's start. The sternum. One second. Let me put it here. Okay. So the thorax, the thoracic cavity, the thoracic cage, the thorax. Okay. Okay. Let's start. We know in the thorax part we have one bone named as sternum. Now, which sternum? This is sternum. Okay. You can see the marking also. This is sternum. And we have ribs. How many ribs we have? We have 12 ribs. 12 pair ribs. Okay. So it means we have 24 ribs. Now, some of them are true, some of them are false, some of them are floating. Okay. So which are true ribs? Okay. First, let me tell you one thing, that this is sternum. Now you will think that, okay, the sternum, all these are ribs. Okay, all these are ribs. So ribs is joining the sternum. Firstly, this is not the correct thing. This is ribs, this is sternum. But these red colored things are known as the costal cartilage. For that, sometimes the ribs are also called costal ribs. Okay. For this, the costal cartilage. Now, you can see the ribs 1, 2, 3, 4, 5, 6, 7. All these 7 ribs are joining the sternum with the help of costal cartilage directly. Means all these 7, 1, 2, 7. You can count with me. 1. Okay, let me draw something. Okay. So you can see 1, 2, 3, 4, 5, 6, and this 7. Okay. So all these 7 are connecting with the sternum, connecting to the sternum with the help of costal cartilage. This red part is known as the costal cartilage, as you can see here. Costal cartilage. Okay, costal cartilage. So we have it is clear now that all these 7 ribs are connecting to the sternum with the help of costal cartilage. Now, if I told you about this rib, what this rib is doing? This rib is the number 8, the number 8, 9th and 10th. These 3 ribs are joining with the 7th. This was the 7th cartilage. This is joining with the 7th costal cartilage. So it's not directly joining with the sternum. These 3, the 8th, 9th and 10th, these 3 ribs are joining with 7th ribs costal cartilage. Okay. So for this reason, these three ribs are known as the false ribs. Now, where is 11th and 12th? The 11th and 12th, you can see this is present here. This 11 and this, the 11 and this 12. So this both are coming from the posterior side. Okay, but not joining the sternum anteriorly. This is not connecting with the sternum anteriorly, and it is floating in abdomen. Okay, I hope it's clear now. Now just discuss what is written here. True ribs directly attached to the sternum with the help of costal cartilage. First to 7. False ribs indirectly attached to sternum with the help of costal cartilage 8 to 10, floating ribs coming from posteriorly but not joined in the sternum anteriorly, floating in abdomen 11 and 12. I hope it's clear for you all. Okay. So with this, we have completed the thorax. And as you can see that in the next slide, we have the superior extremity and pectoral girdle. It means we have completed the appendicular skeleton. Sorry, I mean the axial skeleton. As you can see, for axial skeleton, we have studied skull bones, cranium and facial bones. Okay, hyoid bone is present in this particular area. Okay, so hyoid bone, ear ossicles, 3 bones are there in the middle ear. Okay, in the middle ear. What are they? You can say SIM, S-I-M, SIM, or you can say M-I-S, miss. Okay, so malleus, incus and stapes. Okay, so 3 bones. And then thoracic cage, we have also already studied the sternum and the rib part and the vertebra, 26 vertebra in adults. Now we will move on to the next topic, which is appendicular skeleton. Okay, so let's start. Okay, pectoral girdle, or which is also known as the shoulder joint and superior extremity. Okay, so first keep it your hand on the shoulder joint, and then so we can see that for the shoulder joint there are so many bones contributing it. Okay, how many bones? 3 bones. What are they? Clavicle bones, scapula and humerus. Now, where is clavicle present? You can see here is also clavicle. Okay, so this is the horizontally present. Okay, clavicle. This is horizontally present, and anteriorly you can see it. Okay, you can see this bone from outside, but if we talk about scapula, it is present posteriorly. By now you are already familiar with the term anterior and posterior, right? So the scapula is present on the posterior side of the body, and this bone is known as the humerus. Okay, humerus bone. And there is very good question in your Viva. Sometimes they ask very often that only long bone lies horizontally. Which is the only long bone lies horizontally? The answer will be clavicle. Okay, so clavicle is the only one bone, only long bone that lies horizontally. Okay, and other long bones are lies vertically. For example, the humerus. Humerus is also long bone. Now we have question, what is long bone? Okay, though this is not the class of the classification of bones, but as the term came, we will discuss it in briefly. The long bones are those bones which has 3 parts, 2 ends and 1 shaft or the body. So if this is a humerus, I mean it's a long bone, you can see this is one part, one end, this is another end. So we can see this is upper end, this is lower end, and this is body or shaft. But this is very simple word, you know. But in anatomy, if you use the anatomical term, that will be much, you know, good for your result. Okay. So we will say that this is diaphysis, the body and the shaft, and the ends we will call as epiphysis. Okay, how to remember? Remember E, ends, ends with epiphysis. So the ends we will called as epiphysis. So in the long bone there is two epiphysis and one diaphysis. Okay. So long bones are characterized by, also you can see the length of the long bone is much higher than the breadth. Okay. There are so many long bones in our extremities. For example, humerus, radius, ulna, femur, tibia, fibula. We will come to it later. Okay. So for now, the pectoral girdle, there are contributing three bones. Clavicle bones, which is lies horizontally, the only long bone, and then scapula present posteriorly. Also the scapula is known as the what? Shoulder blade. Okay. And clavicle is known as collarbone and also beauty bone. If you see the pictures of super actresses, the beautiful actresses, you can clearly see their collarbone. Okay. So that's why it is known as beauty bone also, because it can be seen from outside. Okay. And the scapula and humerus. Okay. So there is also an important question. Humerus is the strongest and longest bone of upper limb, or you can say superior extremity. But remember, this is not the strongest and longest bone of our body. Longest and strongest bone of our body is in the lower limb or inferior extremity. Can you please comment me what is the name of the strongest and longest bone? Anyway, we will discuss it. Okay, let's move on to the next bone. Okay, first, please tell me what is the region of this? 1 second. What is the region? This is from shoulder joint to elbow joint. It means this region is brachium, or let's say upper arm or arm. Okay, so this is brachium region. So in the brachium region, we have only one bone, that is known as the humerus. Okay. And the next, from elbow joint to wrist joint, we have two bones there. Two bones. These two bones are known as radius and ulna. Now you will ask me which bone is radius, which bone is ulna. Let's move on to the anatomical position. Okay, anatomical position. So we know that this is the midline, and towards the midline, those are called medial, and away from midline are known as lateral. Okay. So if you stand in anatomical position, please do stand if you want to learn, because the anatomy is very practical subject. Okay. So in anatomical position, the little finger, you can see the little finger is towards the body and the thumb is away from the body. So from little finger, the bone which is coming, okay, it is not coming from little finger. I am just saying you that the side of this little finger, so this bone is what? Ulnar radius. What do you think? You can think. You can pause the video and you can think. The bone which is on the side of little finger is known as ulna. Okay. Now let's come on to this part. So the middle finger in the midline, the little finger is, this bone will be ulna. See, this is also in anatomical position. Imagine there is a midline. So this is ulna. Okay. And the away from midline is the lateral bone. This will be radius. Lots of important question ask that ulna. Remember, ulna is the larger bone. Okay. If you compare the radius and ulna is the larger bone comparatively. But though it is a larger bone, ulna has no role in wrist joint. Okay. So these are some important points which has not been discussed here. I mean, not put in the notes section, but these points are also important for your exam. Okay. So ulna, and see, we have two hands. Okay. So in right hand we have 1 ulna, in left hand we have 1 ulna. So for this reason it is written like this: 1 into 2 equal to 2. Okay. Then we have the carpal bones. Where the carpal bones is present? In the hand. Okay. So as we know, after this joint the rest is known as hand. So here we have carpal bones. How many carpal bones? Very confusing questions. Carpal bones and tarsal bones. Okay. So remember, carpal bones is 8. Numbered in 8 in one hand. So in both the hand, 16 in number. And metacarpal, how many fingers do you have? You have 5 fingers, right? Please count. If you have 5 fingers, so the metacarpal will be 5. Okay. And thumb will be known as the first metacarpal. Okay. So thumb will be first, and then like this, two thumb, two little finger, it will be 1, 2, 3, 4 like this. Okay. So as we can see that this is thumb. So this is first metacarpal, second metacarpal. Okay. First metacarpal, second metacarpal, third metacarpal, fourth metacarpal, fifth metacarpal. Okay. So these are the metacarpal bones, and then the phalanges. Okay. But when we call a single phalanges, it will not be a phalanges, it will be phalanx. Okay. But for phalanx, we have to understand, okay, there is 14 phalanges. Okay, 14 phalanges. In thumb, we have 2 phalanges. Okay, in thumb, we have 2 phalanges. This is known as proximal and distal. Remember, I have already told you, towards the heart is proximal, away from heart is distal. Okay, but in the rest of 4 fingers, there are 3 phalanges. Okay, 3 phalanges. So that near the heart, it will be proximal. Away from heart, it will be distal, and on the middle, that phalanx will be called as middle phalanx. Okay. So now let's move on to the carpal bones. Okay. Carpal bones, tricks to remember is lateral to medial. First, remember lateral to medial. If you stand in anatomical position, this is very important. Otherwise, every bone will be wrong. Okay. If you forget this lateral to medial. First, we will study about the carpal bones and lateral to medial. Okay. So lateral means if we stand in anatomical position, our thumb will be in lateral side and our little finger will be in medial side. See the anatomical position. Thumb is away from the midline, little finger is towards the midline. Okay. So the lateral bone. Okay. So lateral to medial. So in that particular sense, this picture is wrong. This picture is not in anatomical position. Okay, but still we can study from this picture as well. No issue. So the lateral to medial, and then there will be 8 bones. In one row there will be 4. In another row there will be again 4. Okay. Now let's imagine the proximal row. Proximal row means the row which is closer to the heart, and then the distal row. Okay. So let's imagine this is proximal and this is distal. Proximal means which is closer to the heart. Okay, here this row is proximal, this row is distal. So proximal row, for proximal row, there is one mnemonics. Okay, she looks too pretty. Okay, she looks too pretty. And for distal row, try to catch her. This is the mnemonics. Okay. So for proximal row, what are the bones? She looks too pretty. She comes with S. Okay. So for S, we can say scaphoid. Looks, L. Lunate, T. Two means T. Triquetral. Pretty, P. P for pisiform. Pisiform is also an example of sesamoid bone. Okay. Anyways, we will come to that later. Sesamoid bone. You can just write it down that pisiform is also example of sesamoid bone. Now for distal, trapezium, trapezoid, capitate and hamate. Try to catch her. Trapezium, 2, trapezoid, catch, capitate, hem, heart, hemate. Okay. Now, from anywhere you can learn these mnemonics. Okay. She looks too pretty, try to catch her. But for distal row, the trapezium and trapezoid, this is very confusing. And I can tell you that, see, the trapeze part is same for these two bones, trapezium and trapezoid. But then I is coming and O is coming. Remember, alphabetically I is coming first. So for distal row, you can imagine the trapezium is coming on the first and then trapezoid. Okay. Okay. So this is about the carpal bones. And you can see also, see 1, 2, 3, 4. This is the lateral side as thumb is present here. So first, second, third, fourth. Means scaphoid is here. Scaphoid, lunate, triquetral, pisiform. Okay. So in this order, because this is lateral to medial order. And for the distal bone also you can see that here is the present trapezium, trapezoid, then capitate and then hemate. Okay. So again you can see this is from lateral to medial. Lateral to medial, thumb to little finger. Okay. And then the metacarpals. So for the thumb, this will be known as the first metacarpal, second metacarpal, third, fourth, fifth metacarpal. Okay. And then the phalanx. So as we were discussing, the proximal phalanx means towards the heart and distal means away from heart. Okay. And the middle phalanx will be called as, the middle part will be called as middle phalanx. Okay. So in four numbers, in your four fingers, it will be known as proximal phalanx, middle phalanx, distal phalanx. Also here also proximal, middle, distal, proximal, middle, distal, proximal, middle, distal. But for thumb, one phalanx is missing. This phalanx will be as middle phalanx. Okay. So there is only proximal and distal phalanx. For thumb, middle phalanx is missing. That's why it is 14 in number. For four fingers, 3 into 4, 12. And for thumb, it is only 2. So 12 plus 2, 14. Okay. I hope it's clear now. Now let's move on to the pelvic girdle and inferior extremity. Okay. So for pelvic girdle, we know their hip bone is there. So for hip bone, we have two bones. Okay. For one for left and one for right. And then the femur bone. Remember, femur is the strongest and longest bone of our body. Okay. Of our body. But humerus was strongest. See, humerus is strongest and longest bone of our upper limb or superior extremity. But femur is the strongest and longest bone of our body. Okay. Whole part, whole body. Okay. Next. So from hip joint to knee joint, this region is known as thigh region. So in thigh region, we have only one bone. Same as the brachium part, we have their humerus. Here we have the femur. And then from knee joint to ankle joint, we have two bones. The leg region, same as the hand. There we had, there we had also two bones. But the thing, there we had the humerus and radius bone on the antebrachium region. Here in leg, we have also two bones, tibia and fibula. But in the knee joint, we have one more bone, which is known as the patella. Okay. Patella is also known as the kneecap. Okay. Kneecap bone. This circle round shaped bone, patella. So this is patella. Very important, patella bone. One for right, one for left. And then we have the tibia and femula on the leg region. So for tibia and femula, you can see that medial side. So this is the, imagine this is the medial side. This is the medial side. So the bone which is near, let's say this is the, wait, let me draw a line. So if we draw a line like this, So this is a midline. Imagine this is a midline and this bone is near to the midline, right? So this is medial bone and this bone is comparatively far away from midline. So this will be known as the lateral bone. So here we can see that tibia is nearly closer to the midline. Okay, closer to the midline. So tibia will be medial bone of the leg and fibula will be lateral bone of the leg. Okay, see the here we have also noted that tibia medial bone of the leg and fibula lateral bone of the leg. See, okay. Now let's move on to the ankle joint and the rest of the part which is known as the foot. Here we have the region named as, so the foot region. See, there is tarsal bone 7 in number. Carpal was 8 in number, but tarsal is 7 in number. And phalanges, 14 phalanges, metatarsal also 5. 5 for one foot and another 5 for another foot. Okay. So 10, total 10 for right and left, and phalanges 14 plus 14, 28. So tarsal bones. Tarsal bones. So we have 7 tarsal bones. Talus helps in forming ankle joint. Very good question. Very important question. Helps in forming ankle joint. Then the heel is also known as the heel bone or the calcaneum bone, navicular bone. Then we have 3 cuneiforms. Okay, the middle, the intermediate, and the lateral cuneiform. And then there is cuboid because it's just look like this cuboidal bone. Okay, so we have 7 tarsal bones. As you can see here, all these are pointed out, and we have the metatarsals, 7 tarsal, 5 metatarsal, and then the phalanges. Okay, so it's all about the bones and the human skeleton. We have not only we have studied only about bones, but also we have studied about the terms in gross anatomy and also the positions, the anatomical positions, and so many small but important points of bones. For example, femur, for example, also okay, patella is also an example of sesamoid bone. Okay, patella is the first and biggest example of sesamoid bone, and then the pisiform. Okay, so we have also studied about scapula, the known as the shoulder blade. Okay, and the clavicle also. So these are the bones, and I hope all the slides have been discussed in easy form, and I hope you have all liked it, the lecture. So please share it with your friends and help others to learn anatomy in a simple way. And I myself, homeopathic student. So thank you for watching till the end. I hope you will all be fine. Okay. Stay tuned to my channel. Bye.